Welcome everyone to our webinar today, and we've got a terrific panel that will be engaging their thoughts on all of this. You're going to be hearing from Zenithia Clemens, as well as Ron Moser and Leslie Berkeheiser, and I will go through their introductions in a moment. David, let's go to the next screen. So the outline for what we want to cover during the webinar is to go through kind of the Audit Compliance Program Phase II. Zenithia is going to spend a fair amount of time in going through and giving you kind of the perspective on what OCR is doing and hopefully addressing some of the questions you may be having that OCR has in mind and what they're doing as far as objectives with this Phase II. I'll be talking as well about, we'll then go into kind of a perspective and overview on EHNAC's role, how we're playing a role here as well to assist organizations with their risk mitigation strategies and as well dealing with and addressing some of the OCR issues that Zenithia will be going over. Both Ron and Leslie are going to talk about some of not only the best practices, but also how we as EHNAC and the industry is aligning with the OCR protocol for Phase II here. And then we'll get into the Q&A on specific questions, and I've got some questions for the panel, and absolutely we want to engage as many of your questions and issues that you may be having and comments. So please, as David indicated, as we're going along, please type in your questions, and we'll try to get to as many of those as possible at the end of the webinar. So let me take the opportunity now to introduce the panel. Zenithia Clemens is the Director for the Office for Civil Rights at Department of Health and Human Services. She is the Compliance Audit Program Director. She's responsible for managing the development and the execution of OCR's HIPAA compliance audits, where she leads complex, critical, and urgent tasks and teams promoting the voluntary compliance with HIPAA rules and the HITECH Act. She received her MBA and MHA from the Georgia State University in '95 and '96 respectively. In '92, she received her BS in Health Information Management from Florida A&M, where she was also certified as a registered health information administrator. She was also certified as a project management professional in 2007 by the Project Management Institute. She's had a number of years of experience in healthcare consulting, extending through many verticals of the healthcare industry, including long-term care, acute care, managed care, and the private sector in Georgia, California, and the U.S. Virgin Islands, as well as Washington, D.C. She's an adjunct professor in the Health Informatics Administration Division at the University of Maryland, and she's also on the Board of Director alumni for AHIMA, as well as the mayoral-appointed councilperson for the statewide Health Coordinating Council for the District of Columbia. And we really appreciate Zenithia's participation here and OCR's partnership as we're looking to have this webinar and as we've worked with OCR over these past several years. Leslie Berkeheiser, who is an EHNAC assessor and a high trust practitioner, is an independent healthcare consultant with over 30 years of experience in the industry. Her area of specialty includes healthcare regulations and operations with a focus in security and privacy. She participated as one of the national privacy and security co-chairs for the for WEDI, the Work Group for Electronic Data Interchange, and they're under their Strategic National Implementation Process, or SNIP, from 2003 to 2013. She's been an EHNAC reviewer for 7 years, and for the past 4 years has also held the position of Director of Informatics for a Medicare Managed Care program. Ron Moser is a EHNAC reviewer and a high trust practitioner. He also provides leadership in the development of the new EHNAC programs and industry white papers through his coordination of advisory committees of various industry experts. He has extensive HIPAA and high-tech knowledge and detailed knowledge as well of each of EHNAC's 18 accreditation programs. He has 30 years of professional IT experience, most of which have been specifically focused in healthcare. Prior to his work with EHNAC, he was a director of clearinghouse operations for NDC Health, which is a part of Relay Health. He is also the managing director of Moser House Consulting. He is a certified information systems auditor, CISA, and is a certified risk and information systems control individual as well, CRISC. He's also certified as a Common Security Framework practitioner. He holds a Bachelor of Science degree in Computer Science from Taylor University as well. So that's our panel. I'm Lee Barrett, Executive Director for EHNAC, and what we're going to do is I'm going to try to kind of set the stage here on the industry, where we are, what's occurring in the industry, before I then turn this over to Zenithia to give us the perspective from OCR on the Phase II. So as we look at this, you know, as far as the industry is concerned, and we look at the breaches that have occurred over these past 3 years. In 2014, we had 12.7 million records breached. 2015, we had 111 million. And in 2016, we had 16.5 million records breached. And again, from a HIPAA perspective, you know, OCR has acted in the role here over these past several years certainly, as they're named as providing the oversight as well as providing guidance to the industry on enforcement. The issue has been that with all these various breaches, they've gone out with some very good, what I would call protocol and guidance to the industry. The industry has continued to step up, and they've as well continued to enhance their guidance to the industry. When you look at it from where they started back in around 2012 for their Phase I, which really focused on covered entities at that point, the key is that this has continued to evolve, where we now have both covered entities as well as associates, and you'll hear Zenithia talking about that for what they're doing for the Phase II. We look at this as well from an industry perspective in relation to cybersecurity, and from a cyber side of this, we've had about a 63% year-over-year increase in major attacks. Last year alone, we had 93 major attacks. Many of you are aware of the cyber attack that occurred a couple of weeks ago in the UK. And so the number of attacks is continuing to as well increase exponentially, along with what we're seeing as far as a 300% increase in HIPAA breaches that have occurred over these past 3 years. So we've got the environment. Many of you are looking at your organizations in relation to your risk management and your preparedness planning. And so what we feel that's critical for all of this is to provide to you at least an overview of how OCR is continuing to evolve this, the thinking that they're going through, the process that they're using, the fact that a lot of organizations are continuing to be identified for not only audits that OCR is doing, but as many of you are aware, if there are specific complaints that are also registered with OCR, that OCR will in fact investigate many of those, basically all of those complaints that they get. So they've also provided, I think, as part of their website and the tracking of any of the not only issues that have occurred, but as they have continued to be very aggressively following up with organizations and additional fines that have in fact been levied. I think more and more organizations are becoming aware of the role and the need and the importance of having the level of rigor and responsiveness and perhaps even third-party review of an organization's infrastructure to meet the security and privacy regulations that HIPAA provides, and certainly omnibus rule, high-tech, etc. So with that, I'm going to introduce and turn this over to Zenithia from OCR, as Director of OCR, to take us through kind of their thought process and what they're doing as far as this Phase II audit process that they've been implementing. Zenithia, let me turn it over to you.
Thanks so much, Lee. And where the esteemed title of Director of OCR is just that. I am not the director. Roger Severino is our new director, but I am the HIPAA Compliance Audit Program Director. Thank you guys so much, and I'm really happy to be able to meet with this group today. By way of a quick review, I don't know how much this body is familiar with the Phase I audit, and I don't want to go into too much detail about Phase I, other than to say that we learned a lot from it, and many of the building blocks that were established in Phase I have been incorporated into the second phase. So as you all know, high-tech mandated that HHS conduct periodic audits of covered entities and business associates, and we sought out to do that in 2011, 2012, where we audited 115 covered entities. We instituted a tiered approach across varying entity types, sizes, and complexity at that time. And one other thing that's very important to note is that this is a big difference from what most people or most entities are accustomed to with OCR with our enforcement activities. So we really tried to build this firewall between compliance and enforcement, in that the audit is a good thing. It is something that if done well and if understood by entities, you'll be able to take the practices from the audit program, the results if you are audited, and use those in your internal compliance program. We audited covered individual and organizational providers of health services, health plans of varying sizes and functions, and healthcare clearinghouses. They were all a part of our initial audit pool. And we sought to have a broad cross-section of the different types of entities that were out there because this was just all so new. We really wanted to get a better understanding of who are all the covered entities. We also had varying levels based on entity size, the revenue, and their use of information technology. Our larger plans, and if you've been to our website, you've seen a lot more information about Phase I than what we've had an opportunity to populate for Phase II. But our larger plans and providers were our Level 1 entities, on down to the smaller providers with little to no use of IT and smaller revenues. Those made up our Level 4 entities, with everyone else falling in between our Levels 2 and 3. And I bring all of that up to say, again, it was really important to look at the size of entities because we wanted to make sure that the application of our protocol was one that it would apply to all entities. We found smaller entities struggled across all three of our rules. We specifically note that all size entities at the time were still having compliance issues with security. There were no complete and accurate risk assessments in 2/3 of the entities audited. Additionally, there were poor security and control of portable devices, improper disposal and transfer of PHI, inadequate physical access controls, and insufficient training on how to protect PHI and secure electronic PHI. And so we've heard this in the industry, and so I don't think that these findings come as a surprise. We then conducted an evaluation of the program where we looked at the protocol, we assessed the program's design, the supporting information system and architecture that was used to manage document collection and other audit processes, and used the results of the Phase I audit and evaluation to shape what is now our Phase II. So in discussing Phase II, people still hear the word audit and they cringe. And as we know, healthcare is one of the most heavily regulated industries there is, and you would think, most people would think that an audit, oh, this is a bad thing, especially when you're thinking in the financial industry with IRS. But in this instance, audit really is being used as a compliance tool. It is our non-punitive compliance tool where we identify those systemic issues that are still happening in your organization. These audits permit us to reveal areas where entities are still struggling. Additionally, what will come out of these audits are the leading practices that entities have adopted for their own compliance programs. And I'm going to talk about that a little bit in the end. We are beginning to see some compliance trends. So we're very, very hopeful and pleased to see that. And then additionally, there will be further outreach and technical assistance that we plan to produce and make available as a result of what we learn in this phase of the audit program. So we are continuing to identify leading practices, uncover those risks and vulnerabilities, identify areas for technical assistance, and continue to message our focus and outreach efforts on compliance. Next slide, please. Okay, moving on. Thank you. So desk audits are underway. We conducted over 200 desk audits of covered entities and business associates. Draft reports are going to be going out in batches. So if any of you were a part of the Phase II audit, you may hear from other colleagues in the industry that, oh, we received our draft report or our final report. They're going out in batches. We sent covered entities who were audited against our privacy and breach protocol their draft reports, and we have also received their responses to those reports, and we are currently processing final reports. So final reports of covered entities who were audited on privacy and breach, those reports are going on the street in the next day or so. We're also reviewing the security audits of covered entities, and we'll start sending out those draft reports in the next month. While we're finishing up the covered entity portion, we are in the process of examining documentation provided for our business associate desk audit. So there's a lot of moving pieces, as you can imagine. We've got covered entities being audited on privacy and breach. We have covered entities who are being audited solely on security. And then we have business associates that are being audited, and these are just our desk audits. We're only in the desk audit phase at this time. I think it's important to note that our business associates were selected from a pool of entities that were identified by covered entities. As you know, we don't have a database or one source of business associates. And so one of the document requests that we asked of covered entities who were a part of this round of the audit is for them to give us a list of business associates. Well, what we received was a data dump of every vendor that entities engage with. And so we still see that there are some issues with entities not understanding what a business associate is. So we received over 20,000 business associates or names of entities that they were alleging to be business associates, and we pared that down and came up with our list for our randomized selection for this round of audits. I know that there are questions about the on-site audits. Those will be rolled into our permanent program, and we will conduct those after we complete our desk audit. So at that time, we will review a more comprehensive set of controls than what we're doing currently in the desk audit. And later in the presentation, I'll go over the specific protocol elements that we're looking at in this round of the desk audit. Lastly, it's important to note that a desk auditee may be subject to an on-site audit. So I'll even discuss those instances where we could have follow-up compliance reviews as a result of your audit as well. So turning to the desk audit reporting process, I'd like to talk a little bit about process. We distributed our draft audit findings to 166 covered entities audited earlier this year. Next slide, please. I'm sorry, Lee, should I be advancing the slide?
No, just say next slide, Zenithia, and David will advance them.
Thank you. Okay. So with our process, we send out the draft report, and then entities have 10 days to provide us their responses in writing. And what we received in reply is some entities chose not to respond. There are some entities who just acknowledged receipt of our draft findings, and then there were others that provided us very comprehensive responses. They took this very seriously. And that's not to say that those who acknowledged or didn't respond, they took this seriously, but in the responses for those entities who looked at the draft findings and went back and reviewed the documentation, they really provided us comprehensive responses. Now, with audit solely being used as a compliance tool, corrective action is not required. And I'd really like to repeat that because we receive all sorts of corrective action plans and follow-up plans and schedules, and we're really pleased that entities are using these findings and identifying areas where they need to increase their efforts to ensure they comply with the rules, but it is not a requirement for audit. Moving on in the process, the final report will include the entity's comments, describe how the audit was conducted, and it will present the final findings. And again, that's the process we're in right now of putting those final reports together to get out to the 166 covered entities. Now, in the event we find signs of threats to protected health information, we may open a compliance review, although this truly is not our intention. Thus far, we have not seen anything in this portion of the desk audit that warrants a compliance review. But as I mentioned earlier, we're not done yet. We still have the security pieces to go, as well as the VA audit. Next slide, please. So looking at the desk audit controls, this is where I really want to spend some time because these are the areas of our rules we evaluated in this phase. And if you were not selected for an audit, it would be helpful for you to understand what documentation was requested and the testing procedures we used in case you're selected for audit in the future. So using what we learned in the first phase of the audit program, what we see on the enforcement side of our operation, and from what we hear from our industry partners, we selected privacy's notice and access provisions, breaches, timeliness, and content of notice provisions, and securities risk analysis and risk management provisions to conduct our desk audit. So it's not the full protocol. When we just don't have the resources to audit on the full protocol, but we thought let's look at these areas of where there's still a lot of struggle, where entities are still struggling, and let's make sure that we are at least assessing these areas. And then when we do our on-site audits, it will be a much broader review of our protocol, but it is very unlikely that we would ever audit the entire protocol. So let's look at these in a little more detail because it's very easy for us to say, oh yeah, we're auditing on notice and access and electronic notice of the privacy rule. But I think it's really important for entities to understand what type of documentation you should be maintaining and the type of documentation that we subsequently will ask of you. So for notice, we requested copies of all notices, including those on the website, those within the facility, those distributed to individuals, and there was a time element to it. We wanted to see the notice that was current, the notice that was in place at the end of the calendar year. For electronic notice, we requested documentation that showed us the link to their URL. If you have an electronic notice that you keep on your website, we wanted to see that, we request a copy of that URL so that in assessing this provision, we could go onto your website to see if, in compliance with our rule, it is prominently placed on your website. And I'll talk about what we actually found in this area. Right to access. We wanted to see your policies and procedures for individuals to request access to protected health information. Additionally, we wanted to see 5 access requests that you have granted with evidence of fulfillment. Not only did we want to see those access requests that were fulfilled, we wanted to see those in which you extended the time for response. And lastly, for right to access, we wanted to get copies of your standard template letters If you use the standard template letter or form letter, we wanted to see what those were when documenting access requests. So that gives you a little flavor for the types of documents that we requested of entities. And oddly, entities, some had them and some did not. There were questions about what these were. There's still a lot of questions out there in the industry about what type of documents should have been provided. Moving on to breach. Again, we're looking at timeliness and content. For timeliness, we wanted evidence of 5 breach incidents affecting fewer than 500 individuals. We wanted to make sure that in those notifications, the date that the individuals were notified was provided, the date the covered entity discovered the breach, the reason, and if any delay in notification, we wanted to make sure that that was properly documented. For content, similarly, we wanted 5 breach incidents affecting greater than 500 individuals. We only requested a copy of a single written notice sent to affected individuals. We didn't need to see for all of them, but just one. And the standard template form letter if used, as we did with right to access. And then lastly, security rules, risk analysis, and risk management. We requested copies of policies and procedures of the risk analysis process, documentation that the policies and procedures were in fact in place 6 years prior to receipt of our notification letter, copies of the current risk analysis and the most recent prior risk analysis, as well as the current results of their risk analysis. For risk management, like risk analysis, we wanted to see the policies and procedures for their risk management process. Documentation, again, that their policies were in place 6 years prior. Efforts used to manage risks from the previous calendar year. Security measures to reduce risks as a result of risk analysis. Documentation that current ongoing risks are reviewed and updated. So now, since there's no one standard way for documenting this information, we received thousands and thousands of records, which is fine, which is completely fine. But it is important that entities understand at a minimum this is the type of documentation that is going to be required in response to an audit, and that's what you would be rated against. So whatever standard form or policies that you're using as your template, you want to make sure that you clearly understand that these are the types of things that you need to be able to glean and show forth when providing evidence that you are complying with the rules. So moving on to the next slide for business associate desk audit controls. For BAs, we are examining breaches notification by a business associate to a covered entity requirement. Since this is our first time auditing business associates, we really don't have prior history on how entities are doing in this area. So we wanted to make sure we'd be looking at how BAs are notifying covered entities in order to meet this requirement. So we'll be looking at the standard template form letter used for notification. In particular, some of the things that we're looking for on those template forms is a description of what happened. This is the date of the breach and the date of the discovery of the breach if known. Is it included? A description of the types of unsecured PHI that were involved in the breach and any steps that should be taken to protect from potential harm resulting from the breach. And like with covered entities, as I previously went over, we're looking at securities risk analysis and risk management for business associates as well. So on the next slide, let's look at some of the draft findings we have to date. So as I mentioned, we have not completed our audits of security. So at this time, I'm only able to give you a preliminary look at what we're seeing with privacy and breach. And I will gladly follow back up at some point at the end of the year and give you a more comprehensive report on what we saw also in security as well as with business associates. But for now, with notice of privacy practices, full compliance was really rare. It was very, believe it or not, with all of the guidance, well, I'll say we believe it or not, with the guidance that we have provided with the model notices, that are currently available on our website and the work that we did in collaboration with ONC, we still are not seeing comprehensive notices of privacy practices. We're finding at least one error. And so I strongly recommend, if you have not had an opportunity to review our website, to see those model notices, download them. There are multiple formats available if you like the all text format or a booklet format. There's even a Spanish translation available, but all of the elements that are required by the rule are incorporated into those model notices. And so honestly, there's really no excuse for these notices to not be compliant. Some of the things that we specifically were not seeing consistently on the notices included a statement regarding the individual's rights and a description of how the individual may obtain a copy of their claim record. I mean, that's very important that when you give out that notice, the individual needs to understand what their rights are and how they can get copies of various records. Also, there were failures to include instructions on how to direct the covered entity to send those records to a third party. Some of the notices reviewed lacked a statement that the entity is required to disclose PHI upon request of another person named by the individual. A statement that the entity is required to disclose protected health information to the Secretary of HHS. And finally, a failure to address uses and disclosures requiring an opportunity to agree or object for notification purposes. So again, those model notices are very helpful, and if you have not updated your notice in many, many years, please take a look at that guidance that's available on our site. With right to access, there was a failure to provide policies and procedures addressing reasons for denying an access request. We must have those policies and procedures that clearly explain what those situations would be, why you would deny an access request, clearly laid out in your policies and procedures. And additionally, we saw a failure to identify the fee amount or how the fee charged to individuals requesting copies of their protected health information, how those fees were calculated. Now, with electronic notice, there was a failure to prominently display a direct link to the notice on the entity's homepage. So in the event that you do provide your notice of privacy practices on your website, having it 5 or 6 clicks down is not going to be helpful for an individual who needs to understand what their rights are, and it is required that it be prominently displayed on your site. For some of the entities, the font was so small it was a part of the site map. It didn't clearly say that it was a privacy notice. It just said all notices. And so we don't necessarily, the rule does not necessarily dictate how it should be labeled. It's just that it should be prominently displayed on your website. And so there was a lot of issues found with entities not doing that. And then additionally, there was a failure to have a policy governing the provision of electronic notice consistently provided in the documentation we received from entities. Lastly, with breach notification, there was a failure to provide the individual with a toll-free contact phone number, the mailing address, website, or email. Those are some of the most prevalent things that were found with breach notification documentation reviewed. And then a failure to provide steps the individual should take to protect themselves from potential harm caused by the breach was another common finding. On the next slide, where we did have those as some of the leading findings, on the next slide, thank you, we did have some compliance trends. We saw some rather consistent compliance in the areas of the notice containing a statement that the entity can release certain information without first getting an authorization. I don't know if at the time when the whole consent requirement was changed that entities went back and updated their notices appropriately, but we did see some trends, compliance trends in the area of that notice being included in the notice of privacy practices. Notices contain the required headers. They included a statement that the entity can use or disclose PHI for treatment, payment, and healthcare operations. And then for our access documentation, we really did see great compliance trends in entities granting timely access to requests for protected health information. And as I've been out here on the speaking trail talking to entities in different organizations, I've learned that in different states, the requirements are a lot stricter. So where the privacy rule requires entities to respond within 30 days, and there are provisions for an additional 30-day extension, there are states that I've heard that now with electronic health records state that they have to provide it within 5 days. And so we're thinking that we are attributing some of the compliance trends we're seeing with timely access to the stricter state law. Lastly, providing breach notification within the required 60 days. We didn't have any issue. We didn't see a lot of issues with that. Entities are providing timely notification of breaches. Okay, so with that, that concludes my overview of the Phase II program and some of the nuances that hopefully myths have been dispelled about what we're doing. I think I just want to stress again for those entities, if you are not selected for an audit, we really do use this as a compliance tool and not a punitive enforcement tool. And the audit program is going to be a permanent part of our compliance and enforcement activities. So you'll hear a lot more from this group on what we're doing with audits. So I'm going to turn it back over to you, Lee, and I'll entertain questions at the appointed time at the end of all of the presentations. Thank you.
Perfect. Thank you, Zenithia. What a terrific overview. And I think your point that you made is important, that even if an organization is not selected to be audited, to use this and what you've gone through as kind of a compliance guideline is an important, I think, set of kind of recommendations that you're making to organizations. So that's great. So let me again say, if you have questions for Zenithia or for any of us, please do type in your questions on the panel on the right-hand side, and we will get to them after we finish the presentation. So thanks again, Zenithia. I'm sure there's going to be a fair number of additional questions and follow-up. So I think as Zenithia has kind of put the OCR perspective here, and for you to understand some of the process that they're going through, as well as the parameters that they're using for their audit. You know, I think many of you are probably saying, okay, yeah, we're looking at this, we're factoring all this into our risk management and preparedness planning. You might be as well saying, well, gee, maybe there's some third-party entities out there that can look to assist us to be reviewing to assure we have the appropriate policies, procedures, controls in place to be positioning our organization in the event we are selected for an audit, or to even review our infrastructure in relation to, in the event from a compliance perspective, we want to assure that you've got the appropriate compliance in place. So EHNAC, you know, just to give you another perspective here, EHNAC as a nonprofit organization, we're a 501c6 nonprofit organization. We were actually founded in 1995. Our entire goal is to really assist organizations in relation to meeting and addressing their risk mitigation strategy as well as their preparedness planning. So we've put together, you know, we've got 18 different accreditation programs that focus on various healthcare stakeholders in the industry, everything from ACOs and HIEs to data registries, managed service organizations, practice management vendors, as well as we have a whole suite of programs for the direct, basically support of the direct protocol under what's the auspices of our Direct Trust Agent Accreditation Program for health information service providers, certificate authorities, registration authorities, electronic healthcare networks, e-prescribing networks. So it's pretty broad-based in relation to the number of different organizations that we are looking to address and assist with their risk mitigation strategies. And we, again, we're focused helping organizations to assure the level of stakeholder trust that you want to be achieving with all the various entities that you're working with. On the next slide, David. Our process that we use for accreditation is very transparent. We have, for example, if any of you want to take a look and see what any one of our programs looks like, you can download any of our programs for free on our website. We also have spent a significant amount of time over these number of years to align our criteria that we use in each of our programs with that of OCR as well. As they've continued to evolve from their Phase I audits to their Phase II, we have worked not only ourselves but with OCR to align all of our criteria and with their audit protocol so that organizations such as yours can be positioned as well as possible in the event you are selected for an audit and to try to address as many of the issues that potentially could be requested of you in the future and to put together that level of rigor as far as the documentation. So our process, again, being transparent is online. An organization has up to a year to go through the accreditation process with 8 months to submit a self-assessment. And then we go through, we actually audit and review any of the sites where protected health information is in fact either exchanged or at rest. So a lot of organizations as well, as they're looking at their third-party entities, whether or not it's business associates or vendors who are performing functions on an organization's behalf, we have a lot of organizations that are asking those entities to either go through EHNAC accreditation to, again, try to mitigate some of that risk as part of their risk mitigation strategy, and or what you're going to see on the next slide is the fact that EHNAC has also moved, and in January we announced that we were also a high trust assessor. So we're working very closely with high trust on the privacy and security side, where we've become an assessor, so our organizations can either go through high trust and EHNAC and go through them both at the same time. And we're trying to, from the standpoint of trying to reduce the amount of compliance, internal compliance, cost, resource, redundancy, organizations will be able to have credit, will be crediting organizations if they go through their EHNAC accreditation with us, we'll be crediting a lot of the privacy and security to your high trust and reciprocally as well. So the intent, as we've gone through this with high trust, is to align all of our privacy and security and again, as well with OCR and the new protocol for Phase II, to position organizations to be able to respond and address any of those risks as expeditiously and as completely as possible. So it's a matter of having that level of rigor, and we think that this has got as well some real value when we've worked, and we are working very closely with high trust as far as aligning our privacy and security components. Our accreditations go beyond privacy and security into stakeholder-specific areas, but this one area to address some of the OCR aspects as far as compliance, as Anithya was talking about, is extremely important, and we've taken it very seriously in aligning and providing the services that we are as a third-party entity. With that, let me go to the next slide and turn this over to Ron Moser and then to Leslie Berkeyheiser to take you through kind of the process that we go through for the development and maintaining our criteria for our 18 accreditation programs, and Leslie to talk about how we have aligned all of our programs with the OCR Phase II audit protocols. Ron, let me turn it over to you.
Thank you, Lee. EHNAC has a very open process for how its criteria is developed and maintained. As Lee mentioned, we're a nonprofit organization and we're committed to involvement from throughout the healthcare industry and getting input for both ensuring our programs address regulatory requirements and also best practices to the degree that it's reasonable based on the size of the organization going through the program. So we have a lot that we've put into both making sure the programs are comprehensive and also that they scope appropriately based on the size of the organization. So the process for developing our criteria, we have a criteria committee that's again a volunteer committee composed of people across the healthcare spectrum, various different types of organizations involved, from providers to clearinghouses, payers, HIEs, financial services, MSOs, ACOs. A lot of different types of organizations are represented there, and there's a commitment that must be made for participation within the committee. It's a pretty good-sized committee. We get a lot of very excellent input and feedback. We also are always collecting feedback as we review organizations for accreditation. We always want to get input into how the programs can be better enhanced. So when we are working with our criteria, we might be developing a new program that goes through a whole process or enhancing existing programs. And EHNAC does release all of our programs on at least an annual basis in January, and we provide updates based on the latest needs of our programs. There are common criteria across all the programs, and then there are stakeholder-specific criteria having to do with the particular services of that program. Again, it might be a ACO program, so there will be ACO-specific requirements, or financial services, lockbox operations, etc. E-prescribing, another one, I'm not sure if it was mentioned, EHNAC is a certified EPCS certifier. So if it's an EPCS, electronic prescriptions of controlled substances, we go through each of those programs and make sure they not only address the HIPAA high-tech requirements, but also that we have specific stakeholder requirements within those. So we gather information throughout the year from the public, from entities going through accreditation, and we put together our updated criteria. And the criteria committee must first approve that, and then the executive committee or the commissioners within EHNAC must approve it, and then it goes out for a comment period for at least 60 days. And that's a public comment period where anyone can download the proposed changes and provide feedback. And then after the 60 days, we do final modifications, and the executive committee has to recommend the final revision to the EHNAC commission, which must approve it for release. And again, this process happens at least annually. We always have a new version of all of our programs in January, and as needed, individual programs could have releases during the year. And another thing I wanted to touch on, there's a lot of awareness regarding significant issues in the industry, whether it be ransomware and the fear of, how do I protect myself against a ransomware attack? How do I deal with cloud computing, and is it safe, and is it something I should pursue? The various different fronts, or mobile computing is another one. EHNAC is continually reviewing these and analyzing what we need to have in place to make sure that organizations that are accredited by EHNAC have appropriate controls in place, whether it's through enhanced training having to do with social engineering to protect against phishing attacks and other types of social engineering threats, or through just having solid backup procedures in place with disaster recovery procedures as a recourse for recovering data if you're exposed to a threat where you would need to recover, such as from ransomware. These are the types of things, among many, many others, that we make sure are included within our criteria and required of organizations going through accreditation. I want to not take too much time on this. We, again, entertain questions, and if you have any questions we don't have time to answer during this call, we will also be providing follow-ups following this session, so feel free to submit your questions, and if we can't answer them here, we can certainly provide those after this session is over. I'd like to turn it over to Leslie, who will talk some more specifically about how we've addressed the OCR audit, the Phase II OCR Audit Protocol, how we've gone through our criteria, not only enhanced the criteria, but also enhanced the additional kind of background information you receive when you're actually going through accreditation, and we have specific protocols within EHNAC that our site reviewers must follow whenever they are conducting one of these audits. So, or when they're conducting an EHNAC accreditation, which addresses as well Phase II of the OCR protocol. So, Leslie, with that, I'll turn it over to you.
Thank you, Ron. As we were working across EHNAC to take a look at our criteria that has been in place, as Lee mentioned, for many years now, but to bring it in alignment with the OCR Phase II examples that are available now on the website, there's a real common thought that we've all said often, and that is that Office for Civil Rights has really provided the industry with a great gift in this level of specific information they have provided. So I'm going to make that statement and then come back to it with some of the examples I want to talk with respect to our lessons learned. As an EHNAC reviewer and a high trust assessor, we're taught to look for layers or levels of maturity across the privacy and security controls that covered entities and business associates put in place. And I just want to quickly talk through what those 5 layers are, and then we can get into some of the examples that are in the OCR protocols and how that is supported. Certainly, number 1, we look for policies to be in place. And of course, I think everybody realizes this, the regulations, whether we're looking at HIPAA regulations or we're looking at best practices or industry standard, the policy itself should be a current document that has basically high-level summary of whatever the goal is. It really is, what is it we're doing? It answers the what question. What are we trying to accomplish here? And certainly as reviewers, we're looking for a policy that is current, that is clear and easy to discern what goal it is trying to reach. Certainly we don't want to see documents that have been written up 5 years before and never touched. And we also want to see documents that grow and we can move through these layers or levels of maturity and see how they build upon one another. So certainly the policy is the number 1 building block. It was very interesting for me to see when Zenithia said some of the compliance findings that they're seeing are that even some of the core policies for individual rights for access and how to deny access are not yet in place. So that's number 1 level of maturity, policy. Second level is, of course, the procedure that piggybacks onto that policy. And as we said, the policy is really the goal or the what. The procedure gives us the logistics. Who is supposed to do what? Who across the workforce of that covered entity or business associate is responsible to do what and when? And certainly we're looking for the procedure document to build upon the policy statements and to give that clarity so that it is absolutely understood by the workforce members in that organization who's supposed to do what and when, and that should be in the procedure. As reviewers, we then look for the 3rd level, which is proof of implementation. So we're looking for proof that the policy and the procedure is in place and it is in effect at the organization as it stands. One example might be in the area of security and thinking about having awareness training. So your policy may have, of course, covered what is consistent with the regulatory requirement. Your procedure may be clear that the security officer and or whoever is responsible for compliance or training is responsible to build the curriculum and responsible to review it on a routine basis. The implementation, or the 3rd level of maturity, we're looking for proof that those policies and procedures are in place and that implementation is indeed effective now. Now, once you get to the 4th and 5th levels, it gets more varied by the organization, whether it's by policy and what you tell your workforce members to do, or it's the kind of technology you use. And this is where, when OCR has addressed things in the protocols, they're really giving us terrific examples of what kinds of things meet the layers or levels of 4 and 5, which are measured and managed. So we said policies number 1, procedures number 2, implementations number 3. Number 4 is that whatever the protocol is measured. So in my example of the security training, perhaps there's measurement, there's a satisfaction survey after the training occurs. Or there's a test that's given to see the level of comprehension. Different ways the actual protocol could be measured. And then that 5th level of maturity is managed. So we want to see that the organization has all of these other building blocks in place, and that there's basically a higher level report, whether that be to a compliance committee or a board of directors, whomever has oversight authority, that they get some sort of a routine report that yes, indeed, we're meeting protocol XYZ, and here's how we're doing it, and here's how we might want to change it in the future to make sure we stay in compliance. So those are the 5 layers that we look for. If you go to the OCR website, and clearly if you haven't already, just Google OCR Audit Protocol, and it'll bring you right up to a page under hhs.gov Health Information Privacy, and the title says Audit Protocol Updated April 2016. Just a few key things to pause with. There's a general instructions area, and there are some basic statements that OCR makes. And as a reviewer, I know that sometimes the devil is in the definitions. Terrific instructions or definitions. One of them is that the document, speaking about the Phase II protocol, says the entity means both covered entities and business associates. So be careful as you're looking through the information in the Phase II protocols, which are very, very detailed. It's very specific and either says specifically covered entity or business associate or entity. OCR also says entities must provide only the specified documents, not compendiums of all policies and procedures. So again, from a reviewer perspective, we're asking that you give us what we ask for specifically. It's much more helpful to know that policy XYZ page 12 is where the excerpt is that meets the answer to which it is we're trying to satisfy the question versus receiving a full 100-page policy and procedure document. And then the last point I wanted to point out on the OCR general instructions page is that they purposely say the definition of workforce, and it's the workforce definition that is in the privacy rule itself, is that your workforce includes your employees, could be full-time, could be part-time, may also include on-site contractors, students, and volunteers, anyone under your direct control. So if you keep those things in mind, now I'm going to move and look specifically at this slide. As we were taking our EHNAC criteria and looking at the OCR protocol, we delved into some of the details, and I wanted to just point out an example of security. I've already spoken a little bit about awareness training and security reminders. And so certainly EHNAC has had a series of acceptable evidence where we'll ask for, if we're looking at security awareness and training, we might say evidence will include policy and procedure and perhaps training logs or curriculum of training, etc., or a security update reminder example. When you look at the Phase II OCR protocol, you'll see they're asking exactly those levels of detail. Do you have a policy? Do you have a procedure? Does it communicate to all members of the workforce, including contractors, periodically? They're asking these how-to questions. Is it in place? How long has it been in place? What's the frequency of it? What are the methods of communication? If this particular one happens to be an addressable implementation specification, so if you did not do what the regulations are suggesting, do you have an alternative, and how have you addressed it? They just couldn't have provided more detailed information. It's been incredibly helpful for us as reviewers to see that these layers or levels of suggestions of evidence are actually included in their questions when you look through their website. With respect to breach, breach was really the newer of privacy, security, and breach with respect to regulatory changes. And certainly it seems the industry has put a lot of emphasis on making sure that the identification, workforce members are trained on how to identify and report a potential issue that may be a breach, that there be a team set aside to investigate the issue, that there be appropriate notifications when the risk level has been completed and deemed reportable. There's a lot of focus on the above 500 individuals at a time affected by a potential issue of a breach. Not so much focus, and I was interested to see that Zenithia went through it when she talked about, when Zenithia worked about the breach component and looked at the under 500. So one of the areas for EHNAC, we had always optionally asked a candidate to provide us with proof that they keep track of, we'll call them onesie twosies, potential breach issues where they had to go through and apply the risk assessment and figure out if it was deemed reportable, but it's only affecting 1 or 2 or 10 or 15 or under 500 people at a time. And of course, the rules for that say that at the end of the calendar year, there needs to be a report to the secretary within, I think it's 60 days of the calendar year, of the close of the calendar year, needs to be a report. And that was something that prior to the Phase II audit protocols was a suggested example for acceptable evidence when an organization was going through accreditation. Now, because OCR very clearly says we are looking for that report, that means, of course, that EHNAC has now made it required as well. So that's a good example on breach. The last area, and probably the most complex, and also probably the area that EHNAC is really pushing, as well as when we do, we work with organizations that are going through EHNAC accreditation and high trust certification. We make sure the scope meets, that the level of privacy controls are commensurate to the level of protected health information handled by that organization. And so we spend a lot of time with our candidates making sure they document the protected health information handled, whether they create PHI, whether they create that designated record set, whether they just receive PHI, if they maintain it, if they transmit it. We have them document that to a great degree. And then if you'd like to turn to the next slide, please, David, we then go into a greater level of detail with respect to the level of PHI. And remember that EHNAC works across a number of different kinds of organizations, as Lee mentioned. And thinking specifically about HIPAA and how we are subject to HIPAA, we have many covered entities, but we also have many business associates. So we're very interested, whether you're a covered entity or a business associate, if you're in a business environment where, number one, PHI may not ever be directly accessed. You know, maybe we are doing accreditation for a data center, and the data center is really acting closer to that conduit example where they're not ever directly accessing anything. Their level of controls should be different with respect to the handling of PHI than, number two, that kind of middle of the road level of PHI. Organizations that have PHI, and sometimes it's accessible to workforce members. Perhaps we're working with a business associate that is a software vendor, and they are having remote access to support their users, and sometimes they see PHI. Well, they may or may not have additional layers of information that protocols, documentation and protocols supporting protection of that data they need. And then, of course, level three, if you're at the highest level, you're either a covered entity and you have to implement those individual rights to access, an amendment, accounting for disclosure, or maybe you are a business associate and you're doing it on behalf of a covered entity. We want to see that you have those policies and procedures and the evidence that I went through, all the layers of maturity, based on the level of PHI that you have. So the area that EHNAC has really pushed the ticket with respect to best practices, since Zenithia opened up by saying this is all being done, looking for systemic issues and looking for leading practices. One of the leading practices is we're really pushing the ticket. Certainly covered entities need to have all of their privacy policies and procedures and controls in place to make sure they follow everything they need to. But also if you're a business associate, or for those of you in AHIP that are health plans who utilize business associates to the degree that they are handling PHI on your behalf, make sure that's documented in your business associate agreement and that all of the respective privacy-related protocols, if the individual rights or the uses and disclosures apply, are addressed. And I think that really brings me full circle to the next slide, which is, if you think about all of this implementation, your first idea here is to know what it is. Where is your compliance gap when you're looking at your privacy and security and breach controls? And then the second place is to address those gaps and to implement policies and procedures to mitigate the gaps. And then that third layer is to make sure that you're maintaining your compliance. But the most important thing, once you've attained all that, of course, is ongoing monitoring. So Lee, back to you for this slide.
Okay, great. Thank you, Leslie. I think, and again, as Leslie kind of took you through some of the alignment that we've gone through, and hopefully giving you as well some good guidance that you can be factoring into your risk mitigation strategies. The key is ongoing monitoring. As you're continuing to evolve and mature your risk mitigation and your preparedness planning for your organizations, ongoing monitoring, not only from a regulatory perspective, but also other best practices that you can look to integrate and continue to evolve are important as you raise the bar and the rigor, as well as how you're looking to manage all of your various business associates and vendors that are acting on your behalf. So with that, what I wanted to do, David, do we have any questions at this point from the audience?
Yeah, Lee, we have quite a few. If you'd like me to start through those. First question that a couple people asked, will the slide deck be made available?
And so that was going to be my next comment. And so the answer is yes, we will have the slide deck available to all of you. It'll be in a PDF form, so you'll all have availability to the slide deck. We'll make that available in the next few days.
All right, the next question is, where are the breach statistics coming from? And those were some of the breach statistics I think that you quoted early in your presentation, Lee.
A lot of them come from the Ponemon Institute. A lot of them as well come from IBM. There are several sources that I have for a lot of the statistics that I've used: healthcare informatics, health data management. So a lot of the stats that I was able to provide to all of you came from probably about 6 or 7 different sources that I have. So there's just a lot of different stats that we're hearing these days. In fact, if you continue to look at various ones, we've seen as well, BitGlass is another one that has their 2016 healthcare breach report. So there are a variety of different sources that were used for the statistics that I provided.
All right. The next few are for Zenithia. When will aggregate data be available based on the audit findings?
We hope to publish that aggregate data at the end of the year. So our current contract that we have with our auditors ends in December, and so we hope to have all of that wrapped up before the end of the calendar year.
So David, just as a follow-up to Zenithia's comments, what we'll hopefully try to do towards the end of the year is perhaps have another webinar where Zenithia hopefully will have some of the aggregated data and additional best practices and lessons learned that they've got that should be willing to share with all of the participants. So we'll look to try to get another one once she has that data towards the end of the year. Is that okay with Zenithia?
Absolutely.
Great.
Thank you for that, Lee.
All right, the next question is, because the scope of desk audits is limited, will the on-site audits cover all the protocols or a subset?
Right, so as I mentioned, and I'm sorry if I was speaking too fast and that was not clear, we did use a selected protocol as I went over for the desk audit, but the on-site audits will be a lot more comprehensive. we will never audit the full protocol. So we'll never use, I think it's like 256 elements in the protocol. We'll never do the full because we just don't have the resources for that, but it would be a lot more comprehensive. So even when we did the first phase, those on-site audits were a lot more comprehensive than the desk audits. If you can imagine, on-site audits are very expensive, and where we received funding for the first phase of the audit program, you know, we went out and conducted those 115 on-site audits, and so we thought we would get a lot more efficiencies and as well as being able to spread our dollars widely if we conducted more of these policy procedure reviews in the desk audits. And so in doing that, there are certain provisions of our rules that just would not apply when conducting a desk audit. So that's why we have a selected protocol for the desk audit, and we will use a much more comprehensive view of all of the 3 rules when we go out for the on-sites in the permanent audit program.
All right, from the same person, understanding that it is hard to predict, is there a ballpark time period in which the next round of audits will commence?
It is impossible for me to predict that. You know, giving you a little peek into our window, we're a very, very small staff. This phase of the program has been augmented with subject matter expertise. We hired contractors. We're not using our investigatory staff to assist us with these. And so in the permanent audit program, though, we're going to explore some of those options. And so there was a huge gap of time between phase 1 and phase 2. And, you know, we had to look at, we tried to build a technological infrastructure to better help us manage the audit program. So we completely automated this phase, whereas the first phase was very manual. There'll be a lot of things and lessons learned internally that we will take a look at the end of the year, not only just lessons learned from the audit results, but program dynamics that we'd want to assess and evaluate and spend some time at the end of the calendar year, beginning of the next calendar year, to make sure that when we roll out the permanent program, we've really incorporated some of the best practices from a program perspective. So I say all of that to say I've gotten really good at saying, no, unfortunately, I don't know when. But it is my goal to not let it be a 4-year time period. We really are going to move forward with the on-site audits, and you'll see more audits in 2018. I guarantee that.
David, let me, I know we're at 2:45. Do we have a number of additional questions?
Yes. I got 4 or 5 or more, actually. I got quite a few more.
Okay. Actually, I think what we're going to have, what we'll do is, if you can, we'll take those questions and we'll get them answered and back to individuals as if we possibly can. If we have individuals' email addresses, we'll follow up with answers to the additional questions. But I want to be respectful of everybody's time. So thanks for all of the questions that everybody has provided. As I said, we'll try to get back to you with answers to those, and secondarily, the presentation will be made available to all of you. And I wanted to take the opportunity to thank all of our panel, Zenithia Clemens from OCR, Leslie Berkeyheiser, and Ron Moser, for really great perspective that they've provided. I want to thank all of you as well for your attendance and your questions, and hopefully we provided you with some good information that you can actually take some action on within your organizations. We'll be having a couple of other webinars this year as well, focusing on some of the cybersecurity aspects that many of you are dealing with, and we'll look hopefully to have another webinar towards the end of the year with Zenithia to provide some of the aggregated data that they've found, as well as some other best practices and kind of lessons learned that she can share. And with that, I thank you all for your participation. Have a great rest of the week. Thanks again. Take care.